是采取把不同的
We have 3 channels to direct patients, one for common patients, one for fever patients, and one for COVID-positive children. Children in severe conditions will go directly to the emergency rooms.
I waited for an hour to prescribe this fever medicine for my child. I think this is already efficient.
I only waited for half an hour today to get the medicine, but last night I waited longer. But I'm okay with it. I understand that the hospital must be in short of medical workers. We needed to give them more time to adjust.
Many of our medical workers have been infected by COVID and need a rest. Our attrition rate is only 60%, so these people are under huge working pressure. But we have a 4-level emergency plan in response to different situations. We're now only at level 2, so people should not worry.